teeth.
Good to see you again, Larry. Okay, so when we last chat, we were left at the clinical workup. So our patients had an initial consult, they've decided to proceed. What's the next step?
Well, that's pretty exciting for them because that means they're going into the clinical workup stage. And what that means is they're going to come into the clinic. We're going to do two things. We're going to look at their medical history in detail, and that'll be contacting their GP or their medical specialist if that's involved, because we want to get them through the procedure with the least amount of issues. We want to then meet with our dental laboratory where we're going to take some moulds of the teeth, we're going to take some photos, and this is where we're going to start to select some colours and shape of teeth to plan your smile.
So basically this process is designing your smile.
Yeah, exactly. So it's not off the shelf, which is exciting because you get input into what you want to look like.
So for people who are wearing dentures, this is really going to change the structure of their face. This is going to change their look.
Look, a lot of people who wear dentures often don't replace them enough. You see people with dentures often have their faces are quite sunken in. So with dental implants, the advantage is we can actually screw the teeth onto the dental implants and put the teeth into the position they should be, which therefore enhances their face, their lips, so you can get quite an advantage from doing that.
So in this clinical workup, we're picking up the shape, the colour and the appearance of the teeth before we've even gone into surgery. So it's sort of like the design process, is that right?
Exactly. So we're planning where you're going. It may not be the final position that we end up, because remember the initial set of teeth are going to be there for 3 months, but it gives us a basis on which to work forward and move forward.
So other than the look and the design and the function of the teeth, what else takes place?
Well, basically, once we've finished that and finished all the medical, done all that, you're ready for surgery.
Do patients get to choose between general or local anaesthetics?
Yeah, of course. You always have a choice in anything. Depends how brave you are. A lot of patients do it under local anaesthetic, particularly if it's one jaw. If it's two jaw, sometimes they go for general anaesthetic. I can say that some medical conditions also recommend that we do the treatment under general anaesthesia.
Okay, so we've done our initial consultant, we've designed our smile. What's the next step?
We're going to go to surgery.
We're going to surgery. Well, thanks again for joining us, Larry. It's been great chatting to you, and we look forward to talking to you soon.
Pleasure.